Hi, my name is Dr. Melissa Chiang. Today what we're going to talk about as part of my acne series is treatments for acne, including over-the-counter treatments and when you should use those. I'm going to start with prescription topicals, then we're going to go into prescription oral medications. For prescription topicals, retinoids are what I consider foundational acne treatment. So we had talked about adapalene as an at-home retinoid or over-the-counter retinoid, but for the prescription ones, there is a plethora of strengths, vehicles, and combinations that a dermatologist can choose to make sure that you're getting something that is appropriate for your skin and your acne type and how many things you want to be putting on your face every day. After that, I like to add a topical cleanser that's either benzoyl peroxide or has some hypochlorous acid in it, because what that does is it helps with the bacterial component of the acne. Topical antibiotics are also an option, but I generally use those with caution because bacteria that causes acne has been shown to develop resistance to topical antibiotics very quickly. And so if we are going to use topical antibiotics, they should always be used in combination with either that benzoyl peroxide or the hypochlorous acid. Now, when acne is getting deeper, or if it's not responding to topical treatment, then we need to think about oral medicines. And generally, oral medicines are used in conjunction with the topicals. And the oral medications are broken up into three categories. So the first is antibiotics. The second is anti-androgen, which is basically for females only. And then the third is isotretinoin. Antibiotics used to be written very frequently in dermatology offices, but you'll find now, actually many dermatologists don't use oral antibiotics as a first go for inflammatory acne. And the reason why is that antibiotics can have adverse consequences or bad consequences for other parts of your personal health, including making your gut microbiome less diverse, but also the public health because there are more drug-resistant bacteria, and we don't want to encourage that evolution. And we have good alternatives. So for women, girls to women, there is the possibility of prescribing birth control pill, and actually that can be very, very helpful for hormonal acne, as well as spironolactone, which is a medication that affects the androgens in your skin and how they create acne. So very helpful, these two, for hormonal acne. And then for males and females, the final category of oral medication is called Accutane or isotretinoin. And that is a medication that is very powerful. It is the most powerful acne medication. It is the only medication that has the potential to cure acne. So a lot of times, especially when patients are younger and they're coming in with severe acne, we have a choice to make because we can spend 5 months typically on an Accutane course and have the potential to cure their acne, or we can do years and years of oral medications plus topicals. And so that's a choice that I like to give to the patient. And oftentimes Accutane is preferred just because of its shortness and not having the need to have ongoing medication. Thank you for listening to this video. There are a lot of nuances to acne treatment, and for those that wanted more detailed information, I wanted to make sure that you had access to it. If you have any questions or comments, please leave them in the chat box below, and I hope you like and subscribe to this channel.